Conferences and CMEs are being organized at regular intervals to focus on world-class treatment facilities available under a single roof. Keeping this objective in view, the 38th Annual Conference of Association of Radiation Oncologists of India was held in Hotel Mayfair Lagoon and Mayfair Convention. This international conference kicked off in the early hours of 24th November and came to a close in the evening, replete with academic as well as research-oriented discussions. However, the main conference started on the 25th of November and was traditionally inaugurated by the invited guests. The dignitaries on the dais admired several aspects of the conference from the core of their hearts.
ମାତୃଭୂମି ମାତୃଭାଷା ଓଡ଼ିଆ ଜାତିର ଗର୍ବ ଦିଅ
has gone for a lot of things and I don't want to be a regulator.
I like the name. You are very
trying to organizing a normal conference under abnormal situation.
I always extend my hearty grateful and hearty thanks to all of you.
After 3-4 years, it will become a clinical reality in most centers.
I just wanted to know for the lesions that mimic meningioma.
Where I showed you that reverse omega sign, that area, you can see that.
See a combination of both. I mean, you have tumor that
here MR imaging the motor areas
And then when you are indicating marking.
Now, if you think that CT is good enough for, are you taking any specifying margin around the goblet?
We typically use IMRT these days. The toxicity is so much less.
With Essential can assemble sometime to have a GB meeting. And after that, I request the rest of the members
that there are volumetric changes. Rear addition of head and neck is a troublesome
components, but let's start with the first. Classify this to histologically based as classical.
I would like to thank Dr. Klassen at the end.
My task is to talk about radiotherapy techniques.
So starting with the next.
Then it is a certainly necessary.
When we think of oligomets, the options open to us is
My job, well, I should have to talk.
To reduce the number of fractions.
Altering the treatment on the basis of.
Okay.
I want to thank
In Germany, only 2/3 of the patients that should be treated with radiation therapy are referred.
That is, which many people think as a bomb.
I'll talk about the uptake of the start hyperfractionation left of the line. In other words,
combination of chemo and radiation therapy.
This presentation over the next 15 minutes is a clue.
As you all know, women with history of breast cancer have 10 to 50.
functional imaging with DWI and the right radiation map. I would like to point out
The galaxy of faculties having international reputation were cordially invited to share their precious knowledge with the local delegates, and there was a brainstorming discussion on many research-oriented treatment methods.
My name is Dr. Giri. I am the chairman of the Indian College of Radiation Oncology. The Indian College of Radiation Oncology is a teaching wing of the Association of Radiation Oncologists of India. The college is meant for teaching purposes. We have a unique program which is for as compared to all other organizations. Every year we hold not less than about 7 programs across the country. The teachers or the faculty come from across the country and the students come from across the country. These programs are held in various centers, again as I said in various centers in the country. And the main purpose is to teach both the postgraduate students the subject and various perspectives from different teachers, and also in the post-MD we are also holding programs basically for advancement of their careers in the subject per se. The college of course plays an important role where the teaching is concerned and for professional improvement. Obviously, the students are exposed not only to the teachers, various faculties and international faculties many a time. The 38th conference that is being held now, we chose the topic of radio diagnosis, which is very important for us as a radiation oncologist, and we are extremely happy that the response has been outstanding. The very need for having radiology as part of our teaching has ensured that we have not less than about 200 odd delegates for the pre-conference workshop completely. So this really shows that the integration of both radiology and radiation oncology is extremely important, and it has helped in improvement of the overall treatment.
National conferences are organized across the state every year to update the doctors working in a specific state, along with the doctors participating from various regions of the nation. In this process, they also try to look for and understand the latest technologies of treatment.
John Yarder, Professor of Radiation Therapy at the Royal Marsden Hospital in London, UK. I'm here as a guest of Professor Marina of the All India Institute of Medical Science here. And I've come to talk about radiation therapy for women with breast cancer. My specialty is how to deliver that treatment most efficiently and safely. One of the other themes of the conference is the enormous advances in the physics of radiation therapy, the technology which has enabled radiation to be delivered far more accurately to men as well as women with all forms of breast cancer and other cancers with much higher curative intent. I'm experiencing it very well. I've just arrived from London, UK. I mean, apart from the wonderful surroundings and climate, I'm meeting colleagues and friends that I've been in touch with for more than 35 years when I first came to India.
I am Belgium, Europe, Western Europe, but I work already 25 years in the Netherlands.
And have you, sir, any talk here?
Sorry,
have you any lecture here, sir?
Have
you any scientific talk here in this conference?
Yes. Tomorrow I have a lecture.
Tomorrow you have?
Yes.
So regarding
the Din Shaw lecture.
Regarding the talk, you have to tell a short summary and how you are experiencing this conference and how the experience these conferences are making benefit to the public.
Okay.
These things you have to tell.
Yeah.
Maximum 2 to 3 minutes.
Yeah. So I just tell something. You don't ask me questions. I am
not asking anything. This is a guide actually.
Okay, that's good.
Directly you look at the lanes and tell.
Yeah.
First of all,
worldwide.
Huh?
What was the okay? I can start when I want. Okay. I'm Philip Ortmans, radiation oncologist working in the Netherlands, and in fact I'm here representing ESTRO as former president of the European Society for Radiation Therapy. I start again. I made okay, I start again. My name is Philip Ortmans. I'm a radiation oncologist working in the Netherlands. In fact, I'm here representing ESTRO as the former president of the European Society for Radiotherapy and Oncology. We are fortunate to work very well together with international societies such as AROI. AROI is the Indian organization for radiation oncology, and I'm very happy to be here to tell about how we can further improve the fate of the oncological patient. Tomorrow I will lecture. It's a very honorary lecture recognizing all what Professor Din Shaw did. She unfortunately died 5 years ago. Most important for radiation oncology is that we further improve our knowledge and how to use the modern technology that is now becoming more and more available. Radiation oncology nowadays, if handled well, is a very safe, effective and very cost-effective procedure to treat cancer patients, as well in the curative setting as in the palliative setting. Coming to India is something special because the developments in Europe are different from the developments in India. The burden of oncology and the number of cancer patients are quite different, and also the case mix is not the same at all. So other types of cancer are more prominently presented in a country like India. We are sure that by collaborating we can altogether improve the fate of the cancer patients in India as well as worldwide. So conferences like this are hugely important for the public.
The conference was organized in a systematic manner so that proper attention can be given to faculties from all the states and all other delegates.
Dr. Rajesh Vasisht, I am Secretary General of Association of Radiation Oncologists of India. This our 38th annual conference holding in the Bhubaneswar by under Dr. Senapati and Dr. Parida. Last year ये लखनऊ में हुई थी. लखनऊ से अभी तक हमारे 500 मेंबर इस साल बढ़ गए. इसमें कॉन्फ्रेंस में मेन थीम है कि जो न्यू टेक्नोलॉजी आई है उसका यूटिलाइज कैसे किया जाए, हाउ यूटिलाइज करके हाउ इट विल बी गोइंग टू गिव बेनिफिट टू पेशेंट्स. तो इनडायरेक्टली कॉन्फ्रेंस में जो हमारे लोग बात सीख के जाएंगे कि भाई नई टेक्नोलॉजी आई है, बाहर से भी यहाँ पे 10-15 स्पीकर आए हुए हैं कि न्यू टेक्नोलॉजी सीख के जाएंगे, हाउ इट विल बी यूटिलाइज इन देयर सेंटर एंड इनडायरेक्टली कि द पेशेंट गेट बेनिफिट टू डिसेंट एडवांसेज. नाउ एट प्रेजेंट वी हैव अराउंड 2800 मेंबर्स इन दिस. इंडिया के बाहर से करीब 10 से 15 के बीच स्पीकर आ रहे हैं. दे आर मास्टर्स इन देयर फील्ड्स, स्पेशलिटी के भाई इन दी न्यू era of the radiation technology.
Scientific sessions were designed to orient the delegates on radiation oncology. Besides, the speakers as well as chairpersons were selected as per the expertise and experience in their own field.
This is the 30th AROICON Association of Radiation Oncologist Conference. So this is the national conference. We have delegates from abroad also, outside India, and all part of the country delegates have come to attend this conference. Basically it is a scientific symposium where we are discussing about the cancer treatment, especially dealt with radiotherapy. In this conference actually lot many things are being discussed, newer things are being discussed where it will help for our oncologists to learn and treat the cancer properly. And the conference is simultaneously done in 3 halls simultaneously, and in these halls all the eminent scientists and the doctors, those who are treating, or the clinicians, those who are treating cancers are there present, and they are presenting their data and their research materials to share their research material to other doctors and all, which is going to help our patients, also help our oncologists of the state to learn all these new things from them.
How many scientific sessions has been designed, sir?
See, it's a 2.5 day, 3.5 day conference. First day was ICRO, that is for the postgraduate students. So all over the country, from all over the country, the postgraduate students have come. And next 2.5 day in 3 halls are there, all scientific content, starting from CNS oncology or neuro-oncology to head and neck and GI and GU, all these. We are covering almost all part of the cancers in all these halls.
What do you hope, sir? How the conference?
Within now it is around 1.5 day already, and if you see here, very nicely organized, and the halls are almost full. Everybody is very enthusiastically attending the conferences, and also because they are getting much more study materials and materials for the treatment of patients. That's why they are all sitting inside the hall. You will find very rarely person outside the hall rather. That's a unique of this conference.
Cancer being the most common non-communicable disease that can become most dreaded if neglected, there is a vital necessity of knowing the ABC of it by one and all.
Before we got independence in 1947, the major causes of illness and death was due to communicable diseases like cholera, smallpox, plague. There was a disease called rural fever. So they were basically dying of, people were dying of communicable diseases. But gradually, the healthcare in this country has substantially improved. Today, the cause of death is mainly non-communicable diseases. Mainly, of course, communicable diseases are still there, we have not still eradicated, like cancer, cardiac diseases, trauma, and stroke, side effects of diabetes and blood pressure. These are the main causes of death. So, before 50 to 60 years, we were not discussing about cancer that much, but today we are talking about these non-communicable diseases because they are the main killers today. That's why we have to discuss. The radiation therapy conference, which is being held here, it is the 38th annual conference of Association of Radiation Oncologists of India. Radiation oncology as a subject started in 1895. It was exactly 8th November 1895, a Friday, when Dr. Röntgen discovered the X-ray. That was in the evening. From there, 3 specialty groups. One is radiation oncology, which is radiotherapy. Second is radio diagnosis, which is taking images by X-rays. And third is nuclear medicine. All these 3 are now very important, very highly developed. In more than 100 years since Dr. Röntgen discovered X-ray, we had other improvement also. Some of the most important were the discovery of radium by Madame Curie in 1898. In her family, 4 people got Nobel Prize because they were great discoveries during that time. That was also influenced our radiation treatment quite a bit. Those days, we used to use radiation without knowing the effects of radiation. Like with radium, we used to, those days, Madame Curie's, if you see Madame Curie's papers where she was writing, there was radiation in those papers because she didn't know that, these are all documented, that radiation can be harmful also because they were not knowing it. So they have sacrificed a lot. But today, we exactly know how to use radiation, how much of radiation to give, how much of dose to give, how much of fraction to give, and whom to give what. That exactly we know. We have precise measurement of radiation. And those days, people were giving radiation either anterior posterior or by force field, but today we give exactly to that site where there is a tumor, and this is all achieved by improvement in the computer and this information technology sciences. And it is such improved nowadays that you cannot commit a mistake even by mistake. Like in a department where there are 100 people working, only one person has the password who can change the entry which many people have done in the computer. Everybody cannot change. So it's good from a manual system, where manual system, if you write 3, it may look like 8, 7 may look like 9. So these things are all avoided. Nobody can change this system. The most important thing has been that we know exactly how the radiation changes the biology of the tissue. Previously, there were a lot of reactions. People used to call them radium burns, all those things, but they have all become things of the past. We know exactly how much of radiation to give. That is why the cure rate with radiation has substantially improved. You will be surprised that there are many tumors where radiation with surgery, with chemotherapy, the cure rate has reached almost 90 to 100%. There was a publication in 2010 Journal of Clinical Oncology, December, where there are 5 cancers where the cure rate has crossed 90%. Some of them are prostate, 100%. If a stage 1 prostate cancer comes and you treat it, the cure rate is 100%. So the myth that cancer is incurable has gone. Thyroid, the cure rate is 95%. Testis, the cure rate is more than 95%. So there are many cancers now which are almost totally curable. There are other cancers where we are struggling to cure. Not that we have got exact, success in every cancer. For example, lung cancer, we are still struggling with radiotherapy, with surgery. Our cure rate is still around 30-40%. Pancreas, the disease where due to which Steve Jobs died, our Apple man died. Pancreas, still the cure rate is around 20%. We are doing a lot of, research on that. I'll tell you a little bit about this conference. This conference is being held in my own state, that is Odisha, so I am really delighted to be here. And you will be surprised that maximum number of delegates so far, this is the 38th conference, 1100 people are attended. And today the hall is totally full. Nowadays the students or delegates attend the conference only if the academic matter is good. If the academic matter is not good, people don't attend. They just, leave the hall. So the program has been organized in such a nice way that the hall is full. How this conference helps people? Whom does it help? Ultimately, it helps the public. Whatever, like I am a senior person, I am still learning. I want to learn because every day there is something new. Unless I learn, how can I pass on this knowledge? How can to my student or to the patient? So our students are learning, we are learning, and we give public lectures also in the television, in the print media, when we go to a conference or otherwise also. So the public also learns. I'll tell you definitely one thing which is very important. 60% of cancers are preventable. That is how it is different from diabetes and hypertension or blood pressure. Diabetes, BP, they can be controlled. But cancer can be prevented, can be early detected, and can be cured to a large extent. Tobacco is the biggest cause of cancer. 40% cancers in India are tobacco related. If you don't take tobacco by mouth, majority will not have an oral cancer. There are 18 cancers like throat, food pipe, etc. 20% are infection. Like cervical cancer is a cancer which is related to an infection called HPV 16/18. Fortunately, there is a vaccine which is available now against HPV 16/18. So how good a disease where you can prevent, you can early detect and cure. Thank you very much. ଆପଣ ଟିକେ edit କରିଦେବେ ସମୟ ବର୍ଷ ମୁଁ ବେଶୀ କହିଲେ I am Dr. G.K. Rath. I am a professor of radiation oncology at the All India Institute of Medical Sciences. I am also the chief of the Dr. B.R. Ambedkar Institute Rotary Cancer Center, which is a part of AIMS. And now I am the head of a new National Cancer Institute, which is coming under AIMS in a place called Jhajjar in Haryana. It's going to be the largest cancer research center in the country with 710 beds.
The senior radiation oncologists of Odisha participated in the conference and shared their experience of previous conferences and that of today.
This is the 38th annual conference of Association of Radiation Oncologists of India. And it is now venue is Mayfair, Hotel Mayfair Lagoon, Bhubaneswar, the capital city of Odisha. And around 1,000 delegates, little more than that, have come, both from within the country as well as from abroad. We had around with us near about 30-35 delegates from abroad, comprising from USA, UK, Japan, Netherlands, etc. Very high luminaries, having expertise in their own field. We are lucky to have them with us. And we have arranged very busy scientific session schedules from 24th to 27th lunch hour. This is the total from 24th, 25th, 26th and pre-lunch 27th. We are having the conference. And first day we are having specifically, it has been earmarked for the juniors. There is a ICRO program, Indian College of Radiation Oncology, for the postgraduate students to educate them, to update them in the latest development in the management of cancer. And rest of the days, all the senior faculties as well as the juniors, they take part in the scientific sessions, having specific programs. Very burning cancer problems in our country is oral cancers, breast cancer in female and cancer cervix in female. We have got special sessions on that. We have got panel discussions on that. And authors who have many works on this field, they are taking part in the panel and in the scientific sessions. So this will definitely throw a good light on the society, and it will help the updating the knowledge of the common people regarding cancer management. Cancer is no more incurable. Cancer means death. It was a myth. Now it is curable. We are struggling, the whole world is struggling now to catch the patients in early stage. If we catch them early, we cure them. And to catch them early, people should be aware of the disease. What are the things they should suspect that they are having cancer? That is the purpose of this conference. We are making the people aware regarding the cancer. This disease, cancer. And also we are highlighting the mode of treatment. Many things have been known now compared to decades back. The management of cancer has been very much streamlined and very updated things have come out. The treatment line have been streamlined and the results are very encouraging.
I am Professor K.C. Sahu. I am the President of the Odisha State Chapter of AROI. This time we have organized this All India Cancer Conference. This is for 4 days, and in this conference we have nearly 900 delegates from all over India, and they are giving their ideas and giving their knowledge for the treatment of cancer. This is a conference for 4 days which we shall include all organs of the body, like oral cavity, like base of the tongue, like esophagus, stomach, cervix and brain. So all these topics, they will be extremely helpful for the delegates as well as for the doctors, those are practicing cancer in Odisha. In Odisha also we are doing all possible cancer managements, including at Kotak there is a center, AHRC Center Kotak, and as well as there is Ponda Curie Center at Telangapent. And at Bhubaneswar there are 4 to 5 cancer centers which are developing gradually, and they will be helping the poor patients of the society. This conference is for the doctors of Orissa, those who are practicing cancer treatment. And every year this type of conference is going on all over India, and this time we are doing at Bhubaneswar, and it is in a very successful manner. All the 4 days has become very successful and very much teaching, and it is helpful for our doctors of Orissa.
Thank you.
This conference is nicely organized because there are 2 organizing secretaries, one from Cuttack and one from Bhubaneswar, and they are doing very well. They have organized the conference very well, and we have taken the help of the pharma people for the conference.
The budding radiation oncologists got a chance of case presentation and experienced the advantages of such conferences. They made the most of this occasion by meeting the world-class specialists and interacting with them.
I am Dr. Ashish Upadhyay, third year postgraduate of Acharya Hariyan Regional Cancer Center. This is the biggest conference of radiation oncology in India, and this is the second time Orissa has hosted this conference. Doctors all around the world has come here and participated in a very big number. The registration is more than 1,000, and which is the record number this conference has ever had, and we are very overwhelmed because of the response we are getting from all the doctors, be it juniors, seniors, or the doctors from outside the India also. And it has really been a great pleasure, and I am really thankful to all the doctors, the organizing committee, to organize such a wonderful conference, and I am really happy for this conference.
Myself, Dr. Akanksha from Max Vaishali, and I have been attending this ARI conference in 4 days, and it's a really great experience. We have like poster presentations, और हमारे यहाँ पे जो सारे panel discussions हो रहे हैं, and all the topics, they are really very helpful from like for now also as well as for the future, because हम exam going भी है, like I'm a second year resident, so it will help us in exam also as well as to know what are the future prospects of the radiotherapy branch. So that's all.
More than 1,000 delegates attended the scientific research-oriented 4-day-long conference at Hotel Mayfair, Bhubaneswar, and disseminated the updated treatment techniques for the betterment of the society.
I am Dr. A.K. Anand, and I am the Director of Radiation Oncology at Max Hospital in New Delhi. And I have come here to attend the annual conference of the Association of Radiation Oncology of India, which is a national conference. So we are deliberating on some of the very difficult issue of treatment of cancer. And I gave one oration yesterday where I have talked about how a cancer patient, when gets detected with the disease, is left hopeless, and we have to work together, the radiation oncologists, the medical oncologists and the surgeons. We have to work together to give him or her the best possible cure. And that is now possible in many diseases, in many cancers. It is possible to cure the disease because the technology has advanced, the surgery has improved, the radiation equipment has improved, newer chemotherapy drugs are coming, and we are now understanding cancer better, and that is why these conferences are so important. During our deliberations in this conference, we are interacting with each other so as to share our experiences, and also it is a very important forum for young doctors to gain experience, to gain knowledge. They are seeing what major cancer centers of India are doing, and we have some of the speakers from abroad also, from UK and from Europe, and we are exchanging our experience with them so that ultimately young doctors get benefited by their experience and our experience of senior people in the country. And ultimately this experience ultimately helps patients because we can give them a better care and a better chance for survival. So we are very thankful to the organizers, Dr. Parida here, and who have organized this conference so well, and its scientific content is also very good. And the people are enjoying the Bhubaneswar as a place, going around the state, and also scientifically they are learning a lot.
I am Dr. Harpreet Singh. I am coming from Delhi, from Action Cancer Hospital. I've been working, I have around 30 years experience and I've been attending these conferences regularly. So this conference in Bhubaneswar is a conference which has a different mindset or an attitude in which we are talking about the recent advances that have been happening in radiation oncology, especially in the field of radiotherapy. Radiotherapy has seen a lot of advances in the last decade or so, I'll say, and the cancer treatment now is more stressed on the quality of life and improvement of the life of the patients after treatment. So we have a lot of papers where we are discussing treatments in which the patient has a good result, but at the same time has a better quality of life after the treatment and is able to have a normal or a life which is without any need of any help from anybody. This is the main stress that the conference has, and it has been really an enlightening experience to attend this conference, and I am really happy to be a part of it.
It was never an easy task to organize such a grand conference, encompassing all the delegates with intimate and personal touch. Excellent transportation, intimate hospitality, mouth-watering fooding, and entertainment programs rejoiced the delegates.
This is the 38th annual conference of Association of Radiation Oncologists of India, and this conference has been conducted from 24th to 27th of November 2016 at the Hotel Mayfair. In this conference, more than 1200 national delegates and approximately 20 plus international delegates have attended this conference. In this conference, this is a 4-day conference, and in this conference what we have designed that we have to discuss some of the few common cancers like head and neck cancer, cancer breast and cancer cervix. Beside that, as it is a radiation oncology conference, we also have discussed the latest technology in the field of radiation oncology like use of proton in the treatment of cancer. Beside that, the modern technology that is tomotherapy, cyber knife, it is there, that matter also have been discussed. And the overseas speakers, they also mention how best they treat the patient for the cancer patient, and in that technology there is more chances of cure of the disease and also there is less side effects. And the same technology, though the few machines have come out, even also in India, the proton therapy is going to be started. And the same technology because this is a science where the technology has a lot of role. Besides that, though even the machine is required, but the technology, how best we can utilize that machine, that is the issue. And in this program, we have discussed that how best we can utilize the technology, and the same thing can be applied to our patient in our country, specifically in Odisha, because in Odisha few new machines have come, and with the help of this modern technology, we can also utilize the technology for the treatment of cancer patient with radiation therapy. Hope this conference will be of utmost importance and also utmost help for the cancer patient of our state.
This conference was based on a specific theme, leading innovations and nurturing academics for consensus, LINAC. PG students and Masters of Radiation Oncologists graced the conference and described it as one of the best they have ever seen. There was a grand arrangement of delicious dinner.
My name is Murali Nair. I have a PhD in nuclear engineering from the University of Missouri, Columbia. I used to be a medical physicist over here in Indore, from 70 to 74. Then I moved out to the country and I have been to England. and then I moved to University of Missouri. There I did my PhD. Then I took the American Board of Radiology in Therapeutic Diagnostic and Nuclear Medicine. And now I'm practicing as a clinical physicist for the last 30 years in the US in different states. And my main field of expertise is in radiation oncology physics. And most of my clinical experience has been in gamma knife radiosurgery, radiopharmaceutical therapy, and SBRT, external beam abdominal IMRT planning, commissioning of the machines. Most recently we commissioned Electra Infinity and high definition MLC Versa, and Versa we use VMAT optimized radiation therapy for SBRT cases, and we have most advanced technology, and I have been very proud to come and meet with the conference here. It's an excellent organization, and the organizing committee has arranged everything for me to visit here. Tomorrow on Saturday I will be giving my talk on image-guided imaging modalities such as PET-CT, MRI, and fusion technology for integrating all various interventional CT and MR imaging modalities to enhance the planning for optimized radiation therapy. The accuracy of radiation therapy depends highly on integration of diagnostic imaging technology to the system. At the same time, when we finish the final optimized plan, we have to deliver to the machine. The machine also enhances in imaging. That helps us to verify, to make sure that accuracy is still retained during the entire treatment. I'm very proud and thankful to Dr. Senapati and Dr. Valena for inviting me to this meeting, and thank you very much. I'm very proud to be an Indian coming back and seeing this professional organization.
I'm Professor U.P. Shahi, the President of Association of Radiation Oncologists of India. And we have gathered here to for the 38th conference, annual conference of Association of Radiation Oncology of India at Bhubaneswar. And more than 1,000 delegates are attending this conference. And this is 4 days program. First day program was academic program of Indian College of Radiation Oncology, where almost 400 delegates participated in learning newer technology of radiotherapy planning, radiotherapy contouring. That is a very important part in this area. Then the next 3 days we will be deliberating on various issues related to cancer and its management. And I will like to say cancer is a very growing problem at the present in India. Every year we get 14 lakhs of new cases of cancer. And at the present, more than 40 lakhs cases, they require treatment management by doctors. Cancer is curable, and it can be cured provided if it is detected at early stage and treated properly by a good team of doctors at a good center where all the modern facilities are available. Cancer treatment has advanced very much. Particularly radiotherapy has become so advanced that we can deliver the dose very accurately. This is like a surgical strike. We can kill the enemy from a distance without affecting normal people. That's targeted or precision treatment is now possible with radiotherapy. Similarly, with chemotherapy, we are able to deliver the dose at the cancer place. Most common tumors in India are head and neck cancer. Cause is tobacco. If you can avoid tobacco, you can control these cancers. Then other cancers, females are cancer of uterine cervix and carcinoma breast. Cancer cervix can be detected early and it can be cured. Similarly, cancer breast, that is also we can get in early stage and cure it without traumatizing the patient. Similarly, all other sites, all other regions can be affected by cancer. Cancer does not leave anybody. It can affect children, it can be elderly, but elderly, the number of cancer cases increases. So there are very important now agenda to control this, to diagnose these cancers and treat at a proper time to cure it. Prevention is very important. And those cases where, as you know, the causing agent like tobacco, alcohol, in female it is controlling the family. These are important. Controlling the infection. These are important aspects which will help in preventing the cancer. And next we can detect in early stage by increasing the awareness of cancer. The purpose of this conference is that we from different parts of the country get together, discuss various important issues related to different section of the subject and try to find out solution which will be useful to our patient at our respective places. And certainly this provides an opportunity to more exchange of ideas, concepts and newer things to improve the cancer management. That is, I would like to say. I would like to end with a note that cancer is curable. Public should believe that cancer is curable, and if there is any problem, they should come to the doctor and a center where they can be treated well.
I am Dr. Ashutosh Mukherjee, additional professor, Department of Radiotherapy, JIPMER, and I had been invited here to present a debate on radiotherapy in brain tumors, as well as take part in a panel discussion. And definitely seeing the organization, the crowd, and the motivation of the students makes me very happy that we have had more than 1,000 registrations, I'm told, and the talks cover almost every subject, every topic in our subject, and it would be definitely helpful for all the students. All the sessions have been well attended, especially the student training sessions. The halls are completely full, and I am very happy to see that the students are getting such a big advantage in this association conference, and definitely when they go back they'll be able to employ these new ideas and interactions, and definitely it will better the patients themselves. And as far as the doctors from Odisha, we have had a very good interactions with the local doctors, and we are building bridges with them, so they will get to know the outside world, we'll get to know what is being done in Odisha, and definitely both sides will better.
I'm Dr. Sapna Nangia. I'm a radiation oncologist working at the Indraprastha Apollo Hospital in Delhi. And I'm here for the AROICON in Bhubaneswar. I had a talk today. The talk was on the methodology of delivering radiation in prostate cancer patients. I think this conference is going to be a wonderful experience because it's given us a platform to discuss the latest innovations in the field of radiation oncology so as to benefit cancer patients. It allows us to familiarize ourselves with each other's work, as well as allows us a platform to interact with specialists from other countries. So all in all, I think the experience has been wonderful. I think we are all going to go back having learned something new to benefit our patients.
मैं डॉक्टर वीरेंद्र व्यास, प्रोफेसर एंड हेड डिपार्टमेंट ऑफ रेडिएशन ऑन्कोलॉजी, महात्मा गांधी इंस्टीट्यूट ऑफ मेडिकल साइंसेस, वर्धा, सीनियर वाइस प्रेसिडेंट ऑफ एसोसिएशन ऑफ रेडिएशन ऑन्कोलॉजिस्ट एंड प्रेसिडेंट ऑफ महाराष्ट्र चैप्टर ऑफ AROI. तो डॉक्टर दिलीप, आपने ये जो कॉन्फ्रेंस ऑर्गेनाइज की, इतना अच्छा लगा है सब लोगों को, सब लोग प्रसन्न हैं, बड़ी बड़ी कैंसर के ऊपर बातें हो रही हैं, नए नए ट्रीटमेंट के बारे में पता पड़ रहा है, और नई नई तकनीक की जानकारी हमारे यंग डॉक्टर्स और जनता को मिल रही है. इसके लिए आप बहुत बहुत बधाई के पात्र हैं.
थैंक यू.
और आज मैं बताऊंगा कि ये देश में AROI की सबसे सक्सेसफुल कॉन्फ्रेंस हुई है, और ये कॉन्फ्रेंस को लोग जिंदगी भर याद रखेंगे.
So I'm Dr. Rohini, coming from Lucknow, and the conference at Bhubaneswar has been very well organized, and also we've got the opportunity to listen to various international and national faculties, and the topics were of our interest, and we hope that with this recent knowledge and updates we'll be able to help our patients by providing better care to them. So we really enjoyed the stay and the hospitality of the organizers of this conference.
I am Dr. Kirti Srivastava from KGMC Lucknow, and this conference is really organized very well, and a lot of scientific information was there, And basically in our routine practice, we could focus to a single site or maybe one or two sites. So when you have to update yourself for all the malignancies, this is the best opportunity to update yourself regarding all the malignancies, because you have to, in your routine day-to-day practice, you have to deal all the malignancies. It was very well designed and all the sites were covered and all the latest information was given regarding the various malignancies here. So we can go back and we can treat our patients in a better way.
Enchanting music, exciting dance for the esteemed delegates. The delegates enjoyed the occasion up to the hilt in their charming evening. Finally, curtain was drawn on the conference by updating the radiation oncologists for bettering the plight of patients across the nation. The organizing secretary greeted the delegates warmly to the sanctified land of Lord Jagannath. He shouldered the gigantic responsibility of organizing this national conference and released an ocean of pleasure for its grand success. All the faculties and delegates treasured the sweet and useful memory of this momentous conference, abounding in invaluable orientation as well as unique hospitality.
This is a pride of our state to host the national conference, 38th National Conference of Association of Radiation Oncologists of India, and as an organizing secretary, I take the pride of conducting this conference very successfully. We took up the challenge at a difficult time, and I think with the help of all my colleagues, friends, we have made it a success. Amara state re ita gote national conference all English. The theme is
hello.
We took up the challenge at a difficult time. I was having two options. Saying no was the easiest options, but I thought to say yes and to work under difficult circumstances and take up the challenge. I have done that, and I think with the help of all my friends and colleagues, we have made the conference a success. The theme of the conference is innovation. Radiotherapy, as everybody knows, is a technology-dependent subject. We depend on machines and equipment to deliver precision radiotherapy. So we have invited delegates from inside the country as well as abroad, outside the country. And everybody shall discuss what they are doing in their center, what is happening in the country, and also what is happening outside the country, so that we can bring the technology, latest technology to our country, latest protocols, treatment protocols to our country, so that the patients of our country get the benefit, and our state as an whole the same technology will come to our state, and the patients, cancer patients who require radiotherapy from our state will definitely benefit from this kind of treatment development in technology. I am very happy to say more than 1,100 persons of delegates have registered for this conference as of today, and the registration is still going on, and everybody is happy till date, and I hope the conference will be a grand success and end tomorrow. Day one we had ICRO workshop, which was attended by maximum number of students this year, followed by 3.5 day conference of AROI, which was attended by maximum number of delegates and faculty members from inside the country and as well as outside the country. Thank you. I think at the end of the day, I can give the exact picture of the conference. The full conference is going on in 3 halls. Hall A is the biggest hall where all the orisons, the best papers and the international faculty lectures are done here. Hall B and C are divided into organ-based discussions where experts from inside the country and outside the country, they will discuss their experiences in those halls. For the first time, we have done actually 2-3 new things. Number one, under the Digital India, initiative of our Honorable Prime Minister, for the first time in the history of AROI, this year we have done all e-poster presentations. All the posters are presented on LCD panels for the first time in the history. Then the second time, which we have done actually for the first time, we have put an extra camera which is showing the photograph of the speaker on the main stage dais. That is also for the first time in the history of AROI. And I think we have registered the largest number in spite of difficult situations. And other thing, we are taking maximum care to make the delegates stay comfortable. The scientific content is as such very strong and everybody is enjoying and happy, and we are trying to make the hospitality component and trying to take care of all our guests. When the time was very difficult, we are in doubt whether to go ahead or not. Just on time, right intervention was done by the Central Committee. I thank Dr. Rajesh Vasisht and Professor A.P. Sai for their timely intervention and guidance. I thank all my teachers, Professor G.K. Rath, who is my mentor, Professor K.P. Das, Professor U.N. Panda, Professor C.R. Naik, Professor Kailash Sahu, the President, Odisha State Chapter, for their timely advice, guidance and help whenever I wanted from them. I thank all my fellow colleagues also for their help, whatever and whenever I required from them, and everybody have delivered to their fullest so that the conference became a grand success.
ओडिशा के गर्व और गौरव ओडिशी नृत्य से